Hola familia, I'm Dr. Ilan Shapiro. I'm the Chief Health Correspondent and Medical Affairs Officer for AltaMed. I have been part of this amazing community for a while, and I was invited by our CEO and President and Founder, Dr. Turner-Lloveras, a couple of, almost, it feels like decades ago, but when we started having a lot of issues with COVID-19 and understanding that our community as Latinos, we were more affected than other communities. Today, we have an amazing panel, and it's going to be a conversation between us, you, and the future. We'll try to figure out what's happening right now with disinformation, misinformation. What can we do as healthcare heroes, as providers, as people of faith, of people of actually being on the community? How can we actually start a conversation, especially right now that it's hard times? Understanding that our community is being bombarded with absolutely everything, then the Latino Coalition Against COVID-19 is a coalition for everybody. You don't need to be a doctor. You don't need to be a nurse. You need to be a human that actually wants to make a difference. Then today, I am enjoying the pleasure to have in front of us a couple of people that are amazing in the community. We have Mr. Angelo Carusone. He's the president of Media Matters, and also the co-founder of the Latino Anti-Disinformation Lab. He has done an amazing job bringing information and data that we can actually understand. And it's not just what we feel, it's what we can measure and create something to actually protect our communities. On the other side, we have Reverend Dr. Gabriel Salguero. He's the president of the National Latino Evangelical Coalition. He has been out there with the community, marching with the community, and by marching, meaning present, to actually create conversations between all of us. Now, of course, I cannot go without sharing that Dr. Daniel Turner-Lloveras, our executive director of the Latino Coalition Against COVID-19, is here with us, and also the co-founder of SaludConTech, always trying to figure out how can we invest technology, resources to actually move the needle, and most importantly, act quickly. Also, the new Assistant Dean of Diversity and Equity and Inclusion from the University of Nebraska Medical Center, Dr. Alba Rosales, paisano mío from Mexico, and actually paisano from my grandmother that was born in Veracruz. Always a pleasure to have you here. And of course, Dr. Correa, someone that has been fighting in all fields, including being the chair of the International Medical Graduates at the American Medical Association, also the GME Director of Diversity at the University of Arizona College of Medicine, and wears a lot of hats. Then, familia, today it's going to be fun, it's going to be informative, and most importantly, I hope that at the end of this conversation, you will get a lot of tools to actually implement them for your future life, for our community, and to make a difference. Then I want to invite right now Mr. Angelo Carusone to actually have the first conversation with us to share what is he doing, what's the data that he's bringing to us, and most importantly, what can we do? Welcome.
Thank you for having me. So Media Matters is a media watchdog. We live monitor about 60,000 hours of media each year. We archive about 1.5 million hours more. And then we look for trends. We do rapid response work. Last year, we co-founded in this partnership with Voto Latino, the Latino Anti-Disinformation Lab, and basically expanded out all of our monitoring capacities to really zero in on the disinformation trend. I mean, it was really increasing, especially in the last few years, targeting, in particular, the Latino information ecosystem. And there's a couple of things that I think would just be helpful as table setters, because they do provide some context for the uniqueness of the challenge here and the threat. So one, at the start, Latino audiences spend almost twice as much time on YouTube compared to non-Latino audiences. That's the first thing. And it's going to matter a lot when you think about the proliferation, the distribution of not just the conspiracy theories, but the false narratives, especially around vaccine skepticism. The second stat is also significant to kind of help explain just how distorted the landscape is. If you look at the resources, and Facebook is a good bellwether here, but the other platforms have similar trends. On balance, even if there's a little bit of public pressure, Facebook will respond to about 71 to 80% of the misinformation on its platform in English, In Spanish language, it's less than 30. That number gets even worse when you apply it to COVID and public health. So again, you have Latinos spending disproportionately more time on places like YouTube, get it as the first source of information. And the second is that the platforms themselves do not enforce or engage in addressing, especially coordinated disinformation, even remotely equivalently. So it has a really clear landing strip. And the third is actually I think the one that's really significant. And Maria Teresa, who is the head of Voto Latino, often describes it this way, that the way that the sort of these disinformation forces treat the Latino ecosystem and that it serves as is sort of like a petri dish for conspiracy theories, for attacks, that oftentimes we find that they start and germinate in the Latino information ecosystem and then spread out from beyond there. And in no place was that clearer than in some of the COVID public health attacks. So all of the reproductive health attacks and the conspiracy theories about COVID sort of diminishing people's ability to have a baby or get pregnant or creating stillbirths, those actually germinated and incubated in the Latino information ecosystem. And the real intention behind them was not necessarily to get people fully into this conspiracy, it's going to have microchips in you sort of thing. It was actually just to create enough doubt that people waited. And that pattern has consistently followed. So big picture, those three things both, I think, articulate the threat a little bit. I don't want to get too much into the weeds on sort of the responses. I think they'll be part of a discussion, but a big part of the work isn't just to understand the problem, but to try to zero in on what are some meaningful ways that you can engage in this. And the short answer is it's because of how fragmented the Latino information ecosystem is. A lot of it depends on what people are doing in their peer-to-peer channels. There's no single source or silver bullet that's going to respond to this. A lot of it is what individuals are doing in their own social circles.
Thank you for that. And thank you for the introduction. Right now, I'm going to move quickly with Reverend Dr. Gabriel Salguero to give us some type of highlights on what's happening in his realm and what do we need to do.
Thank you, Dr. Shapiro and Mr. Carusone and all of the panelists and all people connected. My name is Gabriel Salguero. I'm the president and founder of the National Latino Evangelical Coalition, a coalition of Hispanic evangelicals that serve the common good and do advocacy impacting Latinos in general in our Latino community. In terms of COVID, NALEC, that's our acronym NALEC, has worked with a public service announcement in Spanish that has aired on Telemundo, Univision. We've hosted multiple national webinars with the CDC and HHS on the disproportionate impact of COVID-19 on Latinos and Latinas. Just to piggyback on what Angelo was saying, there are ecosystems, and the faith is an ecosystem that is often the first place where some of these conspiracy theories get traction. And I think that regrettably, in addition to the kind of the social media platforms, call them YouTube, Facebook, TikTok, Instagram, Snapchat, so forth and so on, what happens is that pastors or faith leaders who have not vetted these comments then share it broadly in their platforms, or what I've seen is in broad WhatsApp chats, right? I belong to several chats of WhatsApp clergy of 300, 200 clergy. And each of those clergy could have 100 people in their congregation, 1,000, depending on the size of the congregation. And so what happens is you now have a megaphone to a disinformation campaign by some of the most trusted brokers, which are faith leaders. And that complicates, to say the least, the issue. And so we'll talk a little further on in the conversation on how we can inoculate ourselves, and no pun intended, to those conspiracy theories. But I think that one of the things is to continue to partner with the medical experts and the epidemiologists. And that's what we've sought to do. The truth is that there has been a historical barrier. I'm speaking for the Brown evangelical community. There are many faith communities, but that's the one I'm the most familiar with. There's been a barrier between faith and medicine that I think need not be there, that we could work together much more strongly and better so that we can overcome this broad disinformation campaign, especially because we're among the groups that is most disproportionately impacted. And so I'm glad to be part of this conversation, and I look forward to talking about best practices responding to the disinformation pandemic.
Thank you so much. And you right now heard, and please do send us your questions. There's a question opportunity down there on the Zoom box or directly with the chat box. We will be monitoring your questions. And that way we can actually answer them. There will be a time at the end of the conversation that we have probably 25 minutes, 20 minutes to actually answer and do a back and forth with the panelists. Then please start preparing your questions as they are. And that actually will help a lot. I want to invite right now Dr. De Alba. And you know, Dr. Alba is actually right now in Nebraska and has seen a lot of changes over there, especially where Latinos are not as well represented as other states. And I'm very interested to hear what's happening over there.
Yes, absolutely. Well, thank you for the opportunity, and it's a pleasure to be here, to be part of this wonderful panel. And it is an honor to be here with you all. So, well, what happens in Nebraska? Let me share a little bit about the population, or Latino population over here. So we're the 12% of the population of the state. We are also the 80% of the total Latino population in Nebraska are of Mexican origin. And the reason why I'm bringing this up, it's because information that comes from other countries tend to run faster. That's something that I have experienced. So I have the opportunity, the honor to work side by side with the community here. And a lot of population, or a large sector of our population, are of recent arrival. They've been here for less than 5 years, or even, around less than 5 years. So what I have noticed is that in the moment we come and share a new information, there was already the information that I find is information that the community obtains, is information that comes from other countries, Mexico mainly, but also from Central and South America. So, and one of the things that, I just to share a little bit also about my background in the COVID-19 efforts. So I'm one of the spokespersons for the medical center here in UNMC, and we are part of the national response operation for COVID-19 at the national level. And another thing also for the context is that, this state has a large representation of I would say, it's been traditionally Republican, and there's some political dynamics there that also impact our communities and Latino communities. But however, bringing this focus back to the information that comes from other countries, one thing that I like to share with my colleagues and peers at the medical center is that we need to inform ourselves about the dynamics that are happening in other countries, such as Mexico, because they might have different vaccines, and which is the case with COVID-19. They have different vaccines, and they come from other countries. They also have different policies or public policies that, the community here gets very confused about, okay, should I follow what it's, happening in Mexico? Should I follow what I'm hearing here? But sometimes the information that they receive is the one from Mexico. So I will stop here because I am very interested to hear about also, other perspectives. But I guess the message for our colleagues and peers out there is it matters what happens beyond the walls and beyond the borders of the country where we are in a public health emergency such as COVID-19.
Thank you so much, Dr. De Alba. And last but not least, Dr. Ricardo Correa, I'm all yours.
Thank you so much, Dr. Shapiro. So a little bit of my experience. I am in Arizona, basically in Phoenix, where our population is 40% Latino population. So we have a very high number of Latinx population, and the focus has been certain areas. One is reaching the community, so being the trust word for the community, and this is working as I work as a medical director for an underserved clinic, mainly a charity clinic, where we start giving information when COVID started, and then training the community healthcare workers to go with us to all that area that the community center covered to give them the correct information. The same thing happened when the COVID vaccine came. Knocking door was the best way to really inform the Latino community. We has been able to also establish a connection in media using the Spanish media, Telemundo, Univision, other mention. But I think that the best impact that we have had is knocking door to door with community healthcare workers and with healthcare workers, so they can know and trust the people that are seeing them for other chronic conditions, and now they are telling you the truth. So that has been part of my work. And being involved with the university, I have involved a lot of the medical students that have a lot of passion on doing this to participate with us on this journey. So train the medical students. Now the medical students go to town halls in cities, for example, Scottsdale City, that have a town hall. They invite medical students. I oversight them, but they take the lead. So the Latino Medical Student Association has been very, very helpful for that. And getting in a lot of activities with our national organization, National Hispanic Medical Association, and other organization that has been created. So to integrate them in all of this information. The other part, I think, that has some impact and that some of the members here work for is a social media platform that try to decrease the misinformation that exists and create a source where the Latino population can go. And this is more helpful in the younger population more than in the older population, but in the younger population, using social media as a way of answering their questions, that has been very, very helpful. Some platforms like Vacunate Ya or Vaccinate for All has been helpful for that. As I mentioned, for the older population, using other medias. I never thought that I will speak in a radio and appear in a radio show so frequently, because, was not so used of the radio, but this is the way that in specific in Arizona, we communicate with the older population. And something that we established was a WhatsApp group or listserv with all of the patients in our clinic. So we have approximately 700 patients that we serve. And then we send them small message, very concise message about things that they need to know, so we can convince them basically. So something that I have focused a lot is really community clinics, community helping the community. And that has been more impactful than the big people telling the Latino population what to do. If you talk to a Latino patient and you tell Dr. Fauci say this, they don't know who is Dr. Fauci. They don't care who is Dr. Fauci. But if you tell the patient, the physician that see you in the clinic is telling you this, in our culture, there is always two big people, the priest and the doctor. So they will follow what those two people are saying. So we also have involved many pastors and priests from our community, and we work together. So we put strength together. And the other part has been very interesting is making the journalists join us so we can disseminate the good information. And I think that we have achieved up to now in Arizona 75% of Latino population vaccinated. The ones that you see and you go out and see that they are using masks, if you ask them, most likely are Latinos. We live in a state, as Dr. De Alba mentioned, that is conservative state where we never had a mandate of anything. So the only way to really inform was telling what was happening. We have some issues, I can tell you, with some, now that I see the Reverend Dr. Gabriel here, we have some issues with some religious faith because they wanted to continue doing mass in close, and we have to talk and then have convince them the leadership of those. But I think that in general, our impact has been good. I think that the trust of the community now sees us as the source for where they can go, and that we will continue doing that. Back to you, Dr. Shapiro.
Muchísimas gracias, Dr. Correa. And right now, I'm going to start with Mr. Carusone. We have heard a lot of things, right? And I would love to tell you that right now we're in 2020, where there's no information, we don't have any evidence-based anything. Right now we have, ample amount of information everywhere. What do you think that we can, because it has been 2 years and still there's certain mistakes that we continue to do as healthcare providers, as public health officials. What do you think that would be right now a couple of learnings in a couple of minutes on what's the thing that we need to learn in order to improve the communication with the Latino community?
So I think that, and this was sort of referenced to in some of what the panelists were talking about, I mean, a lot of what was said is really resonated with stuff that we were watching happen unfold. The dissemination offline, from online to offline to people's social groups that the Reverend was talking about, and then some of the smears really being sort of spread really fast. And I start there because the one thing to recognize are moments. And that one of the things that happened at the beginning of 2021 was that the vaccine was beginning to get rolled out. And so what ended up taking place is the Latino community was disproportionately targeted first. And a lot of this was coming through publications or things that sounded like publications in places like Bolivia and Argentina and Mexico. And then it would get spread on WhatsApp. And one of them was sudden death. They say, there's a story that healthcare workers in Italy took the vaccine and they suddenly died. It wasn't turning people into vaccine, anti-vax necessarily, but they'd be like, I'll just wait. I don't want to just drop dead. It changes the cost calculus. And so that was a moment. And there wasn't a lot of proactive work there. So those sort of things that were adjusting people's rational decisions, they were being more rational, saying, it spread for quite some time before there was anything addressing it. And I think that the first place to start is, are we at another moment now? And we are. We're at a similar moment because the vaccines are now being expanded out to children. And so there's another opportunity for disinformation to proliferate through the same way. And then similarly, there's a need to be proactive and in some ways get ahead of it. If you know what smears are coming, it's not that you have to refute or rebut each of them, but you can address them broadly. And they'll start. They will proliferate. A lot of them are going to be that not just that they'll sterilize their children, but that the biggest one right now is that it's giving children basically serious heart conditions, that they're dying on the fields, that they're playing games and they're dropping dead in playgrounds. I mean, and they're all anecdotes, right? So they're not sending around fake data. They're sending around horrible stories or testimonials from what are people pretending to be parents, right? They're not waiting for real anecdotes anymore. Now they're just making them up. And that's powerful stuff. And that's a similar moment that we were in 2021. What we weren't doing in 2021 was activating people to think about that. So that's the first lesson, is there a moment where the engagement matters a lot? So instead of fighting yesterday's battles, let's fight the ones in front of us. And I think that the voice will make much more impact now because we're right at the beginning of that. The second thing is to consider is what's worked. We don't have, like I said, we don't have silver bullets, but the things that we ran a series of tests targeting vaccine skeptical Latinos. And we ran all sorts of ads just targeting them. And we tested them against the control, so the existing vaccine related promotions that were out there. And the bulk of ads that we had done through the lab had a 54% greater likelihood of converting somebody to getting vaccinated, meaning they'd immediately after that at some point went to search for and register for get the vaccine. If they didn't show up for their appointment, that's a different thing, but that's a big change. It's very different than the control group. And the ads were not doctors. The ads were people conveying, pushback against the sentiment, the things people were really worried about, that they were going to get too sick for multiple days and lose their jobs or have problems with work, that the vaccine would actually make them too sick to work and they'd get in trouble. So one of the ads was just somebody saying, I got vaccinated and I didn't get fired. I thought I was going to lose my job, but there were all sorts of things and it wasn't fine. And I actually went to work the next day. And they were just talking. And other people talking about their anxieties and fears and then saying why they got the shot. One of the highest performing ads was actually somebody just talking about how afraid they were to get the shot because they thought it was going to hurt so bad, and then saying it didn't hurt bad at all. That's not somebody refuting these ridiculous conspiracy theories. But I think the big takeaway from my sense of it, and this is my opinion, not based on data, was that what it was actually doing was the same way that those smears about the vaccine causing sudden death affects people's impressions and cost calculus. I think on the flip side, these ads, which were real people who were concerned and then got vaccinated, what it did was change the permission structure in a way, because instead of it feeling like it was some authority or this appeal to authority, you have to do it. they were responding to things that were really tied in to the feelings that were leading them to be vaccine skeptical in the first place and then getting vaccinated. And what I can say is that, so I think timing matters and early engagement now, and recognizing that some of the broad narratives, not the individual things, but the broad narratives that so in Florida, for instance, one of the big stories percolating right now is that it's no longer a concern to get vaccinated for anybody, for children, for adults, because they've had so much COVID that it actually is the only state in the country that is immune from COVID going forward. That is one of the biggest storylines on Spanish language radio in Florida right now, is that there's no more COVID that could be possible in Florida. They're not saying the vaccine is going to kill your kid. They're saying don't get it because it's not necessary. Why take the risk, right? Engage. And so that's what I would say is that, one, there's a moment, and that timing matters. And then two, the individual messaging to really try to respond to the feeling and the sentiment that has been keeping some people on the sidelines, as opposed to some of the individual nitty-gritty fights over the facts, which I think ultimately get lost.
Thank you for that part. I'm thinking seizing the moment and engaging with the current thing. And sometimes, and it's quite interesting. And I'm going to go with Dr. Turner-Lloveras. And a lot of the times we try to create this elaborate machinery of tested messaging. And what you're sharing with us, it's quite amazing that it's just being human. That, again, going back to all conversations of feelings and the basic things of what actually happened, instead of just what we thought could happen. Then Dr. Turner-Lloveras, tell us a little bit more on the Latino Coalition Against COVID-19. What issues we have had, and what are we improving in order to create this messaging, moving it forward?
Sure. Thank you for the introduction, Ilan. And I'm so happy to see these panelists here, because they're representing the sources or the places where we can actually make the greatest impact in combating misinformation and disinformation. And one thing I'd like to clarify also for those watching is the difference between misinformation and disinformation, right? And so you Google misinformation, you'll see that pop up a lot more than disinformation. And I think it's because everyone just kind of clumps everything into a misinformation category, which is a little bit misleading actually in it by itself, because misinformation is false news, false information without the intention to do harm. And if you look at any kind of crime, you go to a court case, they're going to look at, was there intent to do harm? And that's more disinformation, right? There's also a third category called malinformation, but for the most part, people use, which is very similar to disinformation. I think it's easier to just look at it as disinformation, misinformation. Now, disinformation, false news with the intent to do harm, I think we need to critically look at that problem and completely change the way we interpret it, because it should be looked at as something along the lines of a crime. Because if you look at what is the end result of disinformation, you are putting people at harm, right? If they were going to get the vaccine, but now because of your disinformation campaign, you have prevented them from getting the vaccine. We know that the vaccine saves lives. And because this person did not get the vaccine, they died. If you put that into any other context, if it wasn't disinformation, if it was a gun or a knife, there would be no argument. Police would be involved. And if you look at disinformation, it really is like a virus, right? It's replicating, it spreads, it's contagious. And so I think we really need to critically reevaluate disinformation. And I still can't believe that there's doctors involved in disinformation campaigns. But for those that are caught, where there's evidence to show that this disinformation, this false news derived from this physician, I advocate that their license be taken away. Because at that point, we can't say with certainty or any confidence that this physician is really trying to do what's best for the community or for their patients. I mean, we actually have evidence that what he's doing is harmful. And in any other setting, if a physician prescribes a medication that we know is going to do harm or does harm and even leads eventually to death, the license is taken away. So I just wanted to, share my thoughts on that, because I think that's really important. And I think it would really help sort of combat this misinformation, disinformation, because there are almost no penalties. People can just place it on any social media, and for the most part, they'll get praised by their fans. They might get some hate mail from those who don't like it, but I think there should really be some repercussions for those who are doing damage to our communities. And the other thing I think it's important to raise is who is spreading the misinformation in Latino communities. I'm not sure if everyone saw that article in the LA Times about a story where in Fresno, California, there were 100 campesinos who were about to go out on a Saturday to get vaccinated. There was on the radio station a rabbi that stated if you were vaccinated, it would change your gender. That was the key message in the radio campaign. The vaccinators went to the site on that date, and almost none of the planned 100 vaccinations took place. And they were open about it. They shared it. A leader stated that there would be change my sexuality, and who would want that? Were there any repercussions? Was there any investigation? That's where I think we're at this point, because we all are familiar with the misinformation, disinformation campaigns, but I think we need to start working on, creating the policies that really what will actually, combat and stop these from beginning and being, propagated throughout social media.
Thank you so much, Dr. Turner-Lloveras. And talking about religion and the power of it, I'm very interested to hear how, with Reverend Salguero, what have been the most important conversation that religious leaders have had with the community in order to change this conversation? Because a lot of the times we go and we know that we're looking for trusted source of information. We thought about doctors. We thought about in Spanish, we call it the comadre or compadre, like your close family members that or friends that are almost like your brother or sister. What do you think that we as a community we can learn from religious leaders, and what has been the toughest moments and what have been a couple of learnings?
Thanks for that. Look, I appreciate Dr. Turner-Lloveras and Dr. Correa's comments that faith can be helpful or harmful. Just, I think, like when you analyze any profession, right? Doctors who are spreading disinformation while others are holding fast to their Hippocratic oath of do no harm. Lawyers, across any discipline. And so I think that for me, what has been helpful from faith traditions, and I've worked with rabbis and imams and others to give the facts about the vaccines, is empathy. I think that if I come across at preaching at people, there's more resistance. I think that if I come across as pontificating it's not helpful. It's not persuasive in communities. And so when there's empathy, I think that has been the most successful in overcoming barriers and overcoming suspicion. The second thing is stories from the parishioners, people who have been vaccinated, la abuelita, el tío, el maestro, la maestra. The truth is that they'll listen more to their neighbor who's been vaccinated and they visit all the time and they have family dinners with than probably anyone else. They said, "Oh, te vacunaste y estás bien. You got the vaccine and you're doing well. Oh, it can't be that bad because you're still walking." And so I think that the power of stories from people who we know and we do life together with, I think is very important. I do think there's something to be said about immediate responses. The longer a myth sits, the harder it is to break through. And I appreciate Mr. Carusone's comments on moments. For people who've come to me after hearing a myth or misinformation or an untruth for a while, it's harder for me to break through, even though I'm their pastor. And I've done their baptisms, I've done their wedding ceremonies. They know me. I preach 52 Sundays a year because they've been overwhelmed with these messages. And so I think that there's a sense of immediacy and urgency to not let myths sit over a longer period of time. Lastly, I think that you modeled it. So when I got vaccinated together with my wife, we took a picture and we showed it. And we got up at church on Sunday and we said, we got vaccinated. My two children who were 16 and 13, when they got vaccinated, we shared the story. Story is powerful in many ways, right? Untrue stories can help dissuade people, but true stories of people they know is also very powerful. The last thing I think is the third level of story is tapping deeply into our own faith narratives. There's absolutely nothing in the Christian narrative against vaccines. I've met with rabbis, and we actually had a panel with and an epidemiologist asked every faith leader, is there anything in your sacred text against vaccinations? And all of us that said there, absolutely not. On the contrary, there's more sacred text evidence to say if you love your neighbor as yourself, you take every precaution to protect your neighbor from being infirm. And so it's not just the personal stories of la abuelitas, the tios, the trusted brokers, the teachers, the pastors, but it is also deeply rooted in the best of our faith narratives. It says, hey, part of the common good is loving your neighbor and making sure he or she. The last thing I want to say is lifting up the most vulnerable is persuasive, but is necessary. We have people with pre-existing conditions at high levels. Diabetes, hipertensión, paros cardíacos, hypertension, diabetes, right? Children, my son has a disease that affects his immune system. And so he has to, and so when you tell them, hey, there are people in this community that are immunocompromised, and what you do for yourself, you're also doing for them. And so that kind of connectedness, somos familia por amor a lo más bueno en la vida. We're family. And when you tap into those deepest narrative of love your neighbor as yourself, there are people in your community who are vulnerable, and there's nothing in our sacred text or in our traditions that prohibit you. The last thing I want to say is we used our churches as vaccine sites. Many of our churches in NALEC, in the National Latino Evangelical Coalition, I'm in Orlando, Florida, Mr. Carusone and others who are talking about the narratives in Florida. And so we use some of our congregations as vaccine sites. And they're saying, wait a minute, it can't be all that bad when the pastor's there and the church is being used as a vaccine site. I think that to just not just speak about it, but as the young people say, be about it, has been very helpful.
Thank you so much. And that's very powerful, because we go with traditional route that we want to separate a lot of things. We always are like on that balancing act between what's good and what's better. How can we increase stuff? But it's clear right now, and I agree with you completely, that at least the majority of the religious groups that we have here in the U.S., it's not even a question. You need to do it. It's kind of it's por amor. It's for everybody. Then right now I have a question on the back end for Dr. Correa. Dr. Correa, and I'm going to read it a little bit. I'm impressed with your door-to-door outreach. How do you gain the people trust when you're going out there? And it talks a little bit more on the question from one of our audience on how are you doing it? What's it feeling on the neighborhood? How the team actually works, and what options have you had?
Yeah, thank you so much for that question. So basically, one of the advantages that we have is that we start with the community clinic that is seeing the people in that community. So we are not going to communities that they don't know us. So we partner with other communities and make other clinics do the same thing. But the faces that they are seeing, that they are not knocking the door, is not an outsider. It's a person that they have seen when they go to the clinic and for hypertension or for diabetes. So the reception has been very well, just because we want to talk to them about this, the information, the correct information. So we have received very, very good. There have been some reluctancy in few people when we start talking, and mainly the reluctancy has been because Reverend mentioned is the issue about sometimes not understanding correctly your faith and say, yes, up to now, nothing has happened to me and God will protect me. So then you have to change a little bit your narrative and say, yes, God protect you, but then God gives science, the power of science to humans, and that's how it develops. So you have to try to say that in Spanish and be something very important is that we don't go alone. We go with a lot of the community healthcare workers that are a member of the same street, that are a member of the same barrio. and then they help us, and they know who are the ones in the barrio that are more difficult, and they have been dealing with that in the past, because this is not the first time. We use this community healthcare workers. I have a project called Vida Sana where I outreach about diabetes, and they know the people, so it's the same thing. And then what we have is start teaching the community healthcare workers is how to address these kind of things, training them, but also partnering with other clinics. And something important in our clinic is that 95% of our patients are undocumented immigrants. So they are the ones that they come to the clinic because there's the only way that they can get healthcare. So they really have trust. So it's a different setting than others where you have insurance, and probably your community, they have insurance. In my community, they don't have insurance. So we are the ones that are providing that kind of things. The other thing that we have worked, and I think that Dr. Turner-Lloveras has done this too, is going into the farms. And in the farms, bringing the university, bringing the medical students, and just talking to them. Meanwhile, they are in a lunch break and they are working, and then we say that we are going there. And that has helped a lot people that are, to a certain point, they don't have healthcare, they don't have insurance, but we are going there and providing, and not just coming with the idea of, yes, I'm talking about COVID, but at the same time addressing chronic conditions, the same time addressing healthy lifestyles. So it's not like, oh, my purpose is just going to you now that I need to inform you about COVID and all that, but my purpose is that to a certain point, we will provide you the healthcare as much as we can. Of course, challenging things. This is volunteer work. Nobody get paid for this. So you have to count with people that have the passion for doing it. Sometimes we can get 50, other times we get 20, and it's understandable because everybody have to work. So that's something that you have to balance. At least with the partner with the university, what we have gained is recognition from the university, and the university give you certificate, access for the physician, for example, if they are not part of the university, access to the libraries and things like that. So we have negotiated these kind of things, but when there is no money behind, things get a little bit more complicated.
Thank you for that, Dr. Correa, because that balance between how much we can volunteer and how much we actually can do as a community, it's very important, because I think that the drive for all of us is to make sure that our community is protected, and you open a great opportunity and I'm a straightforward believer, and we have 4 doctors here on the panel that practice medicine, and I think that the magic happens when we close the door in our clinics and everything happens on the street. And that's where, the information that Dr. Carusone and Dr. Reverend Salguero actually gives us, that's where actually the magic happens with promotoras, with community outreach. Then thank you so much for that part. I have a couple other questions, and the next one is actually going to be for Dr. De Alba. And this is actually one of the initial questions that I had here. And it goes like this. What are some of the strategies used to facilitate access to COVID vaccines among uninsured Hispanic individuals?
Absolutely. Thank you so much for that question. Well, first, I will say, and it is actually similar to what other peers in the panel have expressed, is collaboration, because your community might have different situations. There might be some people who have, health insurance, some others who are recent arrivals, but there are community or organizations out there that they're able to provide services, to our communities, regardless of documentation status. Specifically for vaccines, the vaccine is for free. That is a message that we like to promote, and that is something that is true across the nation. So the vaccines are actually, offered without a cost and without documentation status. So identifying the collaborators, such as, like in our particular case, going with the local health department, we actually partner to create clinics out there in the community. And it is a formula that we use similar to what it's been described by Dr. Correa. it's going and reaching out to the community, bringing those mobile units where our Latinas are working, where they go for grocery stores, where they go for prayers. We collaborate also with faith-based organizations, and we establish clinics there. So we try to promote, that the vaccine, is free, but also close to them. Another thing that I will say, related to what Dr. Correa was also sharing is, there is room for those policymakers to change the system. COVID-19 is showing a broken system as well. How we compensate and, how we incentivize those individuals who are putting the extra effort, those community health workers who are putting all these hours and time out there in the community, but they have families. And sometimes, the system don't recognize, all the effort that they are putting. And this is something that's been historically. So we definitely have to find the ways how we adapt these policies, because, otherwise we will perpetuate, that people from specifically underserved or underrepresented minority groups work the extra mile, but the recognition gets into the privileged sectors that they get all these, benefits. So I just wanted to mention that in alignment with what Dr. Correa said. But it is something that we need to be working and fighting day by day and advocate for future generations. That's another concept that I wanted to bring to this discussion quickly. It's to focus in the intergenerational approach. So not only just thinking in just one cohort, what this is just, I'm gonna provide the vaccines to, adults. Let's think also, that this will, what we are doing right now in terms of the programs, the campaigns, has to impact not only the generation, but also the generations that haven't even been born. We need to think in the long term. So that is how public policies have actually need to be implemented, thinking that they will have to be sustainable and also impacting future generations. And what we do now, it will matter for future generations as well.
Thank you so much, Dr. Correa. And right now, one of the things that we have seen is the consistent thing about cultural language barriers, adapting to new waves of information. And sometimes, and I had that collapse in January. I don't know what was your feeling, where we were having Omicron, we had new policies regarding booster shots, and our community, every time that we say anything, it's going back and opening those causes and problems that we had before. And one of the questions that we have here is regarding strategy and how to use, conflict resolution on this part, and making sure that we are sharing the correct facts. Then I'm going to ask, please, right now, Mr. Carusone, to actually give us some tools and ideas on how to bridge that conflict, if there's any good ideas out there, to share actually the real facts.
Yeah, the one thing that just I'm speaking in big generalities, but there is always going to be a segment of people that are not movable, that they are just so deeply committed to it that they're actually not actually remotely persuadable. But that, by and large, that's a really small number. And the truth is that it is not going to be a simple fact that's going to change people's minds, because a big part of what's happening is that they're seeing these things, the narratives are percolating in their own social circles or on YouTube, or they're hearing it on the radio. And there's a lot of, to some degree, trust in that. How could it exist on radio if it was a total lie? Like, there's some assumptions that get baked in. And then, it gets reverberated back in their other social groups or their peer groups or through their friends, and they form their own conclusions. And so I think the questioner is correct that it can be really hostile, because you're telling someone they're wrong. No one likes to be told that. And not only that they're wrong, but that that the conclusion that they've come to is wrong, and that their feelings around it are just totally invalid. And that is how most of the immediate fact checks are responded to. You're asking people to believe this abstract argument from authority, and then separately, you're asking them to completely invert their feelings. And the things that have worked well after something has already spread, obviously getting ahead of it is much more effective. And so that's why the moments matter, and some of the early warning and early detection. Because if you can give people the understanding to engage, great, and how to interpret something. But once it's already spread, the easiest thing to do is to always start from validating people's feelings. And in media or in communications, it's called getting in the circle. That you have to validate the way somebody feels. That doesn't mean you have to validate the facts that led them there or the lies or the misinformation, but you have to validate the feeling, because if you start from that perspective, it's only going to lead to hostility and it's going to close them off even more. So it is valid that somebody thinks that sudden death is going to lead to, from the vaccine, to be a little more concerned about it. But what you have to do is validate that as a real concern, but then walk backwards from there. Or did you know it started from this smear site that was actually run by a bunch of white supremacists that are actually trying to do the ultimate form of voter suppression, which is to make Latinos sicker, right? And that's helpful facts, but you're not starting from there. You're starting from a place of validation. And the biggest takeaway has been consistently that somehow there's this idea that if someone just sees the fact, that everything changes. And a fact never changes a feeling. And I know that sounds really like simple, but that has been the biggest challenge in responding to this, is that so much of it is fact-based, when you should use your source, your place as a trusted messenger to get in the circle and recognize that a lot of this is feeling, and then start to unwind it from there. And it does take work, but in starting from an invalid perspective or ridicule or belittling is basically the fastest way to make it cemented and guaranteed.
Thank you so much for the answer. And I'm grabbing my neck, because a lot of the things that we have done as knee-jerk reflex for the past 2 years have been, I'm going to counterfact, I'm going to do this, I'm going to do that part. And a lot of the messaging that we created, and I have seen a transition in the past 6 months, but you're completely right. They were on the fact-based, this is what they're saying. And we created our own conflict instead of actually bridging. And I love how you actually portray it. It's that trusted source. It's not of course the knowledge, but it's what do you do with the conversation and validating that we can have fear. It's weird. There's a lot of information out there, and after that, going and moving it forward. Then, familia, we are getting to the last part of the conversation, and I want to right now go with Dr. De Alba. Give me 1 minute. Where are we going with this? And where do you think that we're going to, what will be our conversation 6 months from now regarding disinformation?
I think Mr. Carusone said it already, the kids. I think particularly, with the vaccine being now tested for, babies and early kids, that is where we're going to be working a lot, that's where we need to actually inform ourselves, because we as physicians also need to know how to interpret data. So, and I can tell that, as we have discussed it here, the misinformation, disinformation is running very, very fast, but we can predict it. I love that concept too. We can do something now and predict some moves from that end. So I think, starting to work with those organizations, leaders, who work with kids, with parents, it's going to be a key for us in order to, address this challenge moment that we will face in the next few months. I will stop there given the timing here, but thank you for that question.
Muchísimas gracias, Dr. De Alba. And I'm going to go with Dr. Correa right now. I'm very interested to hear, the country is divided, and what do you think that will be the message to unite us?
Very difficult question, Dr. Shapiro, but I think that the message at this point is something that Salguero mentioned, is that if you care about the other, in Spanish, if you care, si tú quieres a tu prójimo, you should do things that will help them. And at this point, we know, and we have evidence, and we know that the vaccines, the barriers, protections is not just for you to protect yourself, but it's to protect the others. And caring about the neighbor is very important. How to unite this country at this point, where not just a COVID vaccine that is a syndemia, it's more than a pandemic, but also in other things that are happening, systemic racism and all of these kind of things. It's a little bit harder to do it at this point. There's a lot of work happening in multiple levels, in multiple areas. And I think that the future generation, and I hope that the future generation will not suffer this, But at this point, what we need to come together as a Latino community is expressing ourselves, telling why we care about each other, telling this in our own language, in our own culture, and united first at this point, the Latino community, to prevent this as a spread. Later on, we will have to work on united the country, and that's hours lecture about how to do it. But thank you, and I think that we are in the right track. This is an example. Thank you, Dr. Turner-Lloveras, for creating this kind of coalition, because this is what we need. I feel sometimes, I'm sorry to be a little bit long, I feel sometimes that we, the Latino community, are so divided that we never get into together. How many organizations, Latino community, they're doing the same thing, and how many we have? There is a point that we need to come together. We represent 18% of the US population, and we need to come together and tell the others, hey, this is the 18% voice. It's not 18% divided by 1,000 organizations that is doing one thing.
Thank you so much, Dr. Correa, the voice of unity on that part. I'm going to give a couple of less than a minute to the Reverend Salguero to have his last remarks.
Thank you again, all the panelists and all the people who took time out of their busy day. Look, to respond to the kind of crisis of polarization and suspicion, I think that we have to have an army of empathy. I do. And I did an interview on CNN about Latino evangelicals and COVID and in New York Times, and I got so much hate mail and so much threats. And what I decided to do was respond and say, thank you for sharing your concerns. I understand your fears. I'm praying for you. Not everyone responded saying thank you, but some of them were persuaded. And so Dr. King would say it is African American History Month. So I'll say that you have to overcome people's capacity for evil and hate and anger with an overwhelming capacity to love. So empathy. And then the second thing is consistency. You cannot tire of telling the truth and telling it tactfully. And so empathy gains a hearing, and truth gains clarification. If we do those two things, and the last thing is partnership.
I love the initial aspect of community and how can we move forward. And Mr. Carusone, please, last remarks before we switch it to Dr. Turner-Lloveras to give us the last part of the conversation.
I couldn't possibly do better than that. I'm not even going to try to poison that well. I'm just going to echo what the last speaker said. It was perfect.
Thank you for that. And for everybody, for the panelists, please just wait like 2 seconds after Dr. Turner-Lloveras give us the last words of today's meeting.
I want to thank everybody that is here today. Really appreciate you joining this conversation, because it's a critical time for this conversation right now. We heard from Dr. Carusone, who shared with us that research shows that the community members have more of an impact on whether or not people decide on get vaccinated than physicians. What does that mean? That means that's good news, because there's only so many physicians, but the community is everywhere, right? And so that for me was an alarm for everyone to really get up and make an impact, because you do make an impact by going on social media, sharing your stories, your posts, going to community gatherings that are either virtual or in place. Dr. Correa brought up the fact that one of the greatest impacts that they're doing right now is volunteer work. There needs to be equity in the distribution of funds, right? If we know that there's a particular group that has been disproportionately affected, then the distribution of funds needs to reflect that. And I think so far, from what we've seen, including the PPP loans, it's actually been the opposite. They should not be volunteers. We need them, and they should be paid. Right? They should be given the respect that they deserve, and they should be on the payroll, and there's funding for that, but it needs to be redistributed. And I think that comes from all of us coming together, as everyone was talking about. And so I encourage everybody to join the coalition. And the thing about the coalition is it's a coalition of coalitions, right? So you don't have to leave your organization. There's no loyalty issues. You come with your organization. We're happy you're with your organization. And we want to uplift all of the organizations. It's more about sharing and reaching across, because with a unified, powerful message that Dr. Shapiro asked about, it's easier to have a unified message if we're all creating the message together. So thank you, everybody, for joining, and appreciate everything that you do.
Thank you so much, Dr. Turner-Lloveras. Please, we'll have the official picture before we go. Then if all the panelists can smile, look at your camera, and Dr. Turner-Lloveras, you will be the one that will be taking that picture, por favor.
And if may I interrupt, thank you, Dr. Shapiro, for all the work that you do as well, and for moderating this great panel. Yeah, amazing work that you're doing. It's outstanding. So we're a team. Somos un equipo.
Exacto.
Yeah. And I just want to echo Armando and says what Ilan always says, familia, familia. That's how he starts every single Instagram that he does.
That's the empathy that, Gabriel was talking about. It's like familia, empathy. It all comes together.
Well, thank you, everybody that came with us. Have a beautiful day. We are here for you. This is the initial part of a lot of conversations. Please, you had the panelists reach us. There's a couple of questions that are pending. I will make sure that Dr. Turner-Lloveras gets them, and making sure that we get you some answers at the Latino Coalition Against COVID.com website. And thank you for everything, and have a beautiful day. Bye-bye.